Hello, this is Barry Wolfe with Marcus and Millichap. I'm really excited about this episode of Wolfe Bites. I'm here with Dion Huey, who is an American raised. Dion, correct me if I'm wrong, went to college and schooling here in the United States. But what's really interesting, I mean, Dion's an interesting guy to begin with, but what's really interesting and intriguing is the fact that, Dion, you've been living in China, whereabouts in China for what, 11 years, give or take now?
Yeah, I've been living in Beijing for 11 years.
So that's really interesting. So obviously, as you obviously know, we're going through this coronavirus pandemic and crisis worldwide. It started over in China, and obviously we're still grappling it with it. We're dealing with stay quarantine, stay at home. I thought you offer an incredibly interesting perspective of an American living in China, and I was just curious to hear your thoughts and your insights. Let's kind of set the clock back when this first started in China. What happened there? What was the process, the quarantining, the stay at home, kind of leading up to where we're at today now in the US? What was kind of the process in China?
Okay, yeah, great question. I'd be happy to talk about that. So actually, I just want to kind of go back to December because, everything started in around mid-December as far as the documented evidence is concerned. And I will never forget, a lot of people out there have probably heard of Dr. Li Wenliang, and he was the ophthalmologist that worked in Wuhan, who was allegedly known as the whistleblower. And the reason why I say that, whistleblower like this is because I've seen a lot of reports in the media, and they're saying that he was trying to warn the world per se and let the Western world, etc. But that actually wasn't what he was doing. He actually worked in the same hospital that these COVID patients were being treated. And it wasn't known to be COVID at the time. It was just some unknown pneumonia disease. Now, just to be clear and to provide people with a little bit of perspective with regards to Chinese hospitals, Chinese medical care is very different than what it is that we have back home in the States. Typically, we'll go to our GP in some private office at a medical office facility, and then they'll make referrals to specialists, etc. But in China, just because of the sheer size, the amount of people that they have here, as well as government controls with regards to medicine and healthcare, you'll have like ophthalmologists, nephrologists, all kinds of specialists under one roof in a hospital. So typically, if you want to go see a doctor or a specialist, you go to the hospital rather than going to a GP. So he worked in the same hospital. He was not personally seeing these patients, but he heard from my understanding is he heard from one of his coworkers, and that they had these unidentified, cases of pneumonia, didn't know what it was. Then he sent in one of his WeChat groups to family and friends, just letting them know, and other coworkers, just to be careful, okay? And that, something new was coming about, and they had no idea what it was, but it seemed to be that it could potentially be problematic and resembled a little bit of like kind of the SARS epidemic that China had faced back in, what was it, like 0203-ish. So that being said, he wasn't trying to necessarily kind of just let the entire Western world or whomever know. He was just letting some friends and family know. Coincidentally, I actually received a screenshot of his message from a friend of mine. So
Back in December.
Very early on, that's correct. So it was like towards the end of December that I had received the screenshot. Now, keep in mind, at the time, the Chinese government didn't actually come online and publicly announce until December 31st. They had basically reported to the WHO that there was this unidentified case of pneumonia, and that they're continually to investigate it. Okay. So actually, before that, I had received a copy of the screenshot of his message, and it was from another friend of mine. I'm like thinking, okay, when I first saw that, my initial reaction was, maybe this is just someone spreading rumors or whatnot. It's probably not anything really that's relevant to me, because Wuhan is about 700 plus miles away from where I am currently in Beijing. And so I just figured it had nothing to do with me. That being said, it wasn't until later on when the Chinese government had announced, like, hey, publicly, we have this problem, and it's spreading, right? So that's when I really started thinking, okay, maybe this could be a little bit more serious than what it was. Now, my first reaction was, okay, maybe I should go out and buy masks because I see more people wearing masks.
Which
Okay,
is kind of
granted,
common in China, is it not? Even
it's very
more so
common.
than the
Even
US.
Absolutely. Even in like winter, you'll see people walking around with masks. I mean, it could be it, and it's not necessarily because they're sick. It could just be masks to kind of keep your face warm.
Okay.
They have these cloth masks, and that's why they do that. I know, particularly in northeastern China, that's very common for people to walk around. Even when I visited northeastern China in the winters, where it can be like minus 40 degrees Celsius, which is really cold, I would wear a face mask. But anyways, I went over to the local pharmacy in my neighborhood, which in this neighborhood you could just think of it like on maybe like a couple city blocks, size. We've got about 4 or 5 pharmacies in this immediate area. So I just went over to these pharmacies looking for some of these medical masks that I could purchase. And the first time I went, they were completely sold out by the time I went. And this was early January. So then I went back. He told me to come back the next day. They'd have a new shipment. And that's when I went back and then I bought them. They were really expensive by that time because there was already a shortage of supply, because a lot of people, their initial reaction was to buy masks. Now, this was
Well,
before.
I'm supposed to buy toilet paper. Y'all supposed to buy masks.
Exactly. Now, keep in mind, Barry, that this happened before the Chinese government, came out with these guidelines talking about, buying masks, buying masks. I
This
mean,
kind of social media side of it, just feeding the frenzy, for lack of a better way, just quietly. Okay.
Yeah, so it was actually quite interesting, just to see the differences in reaction. So in China, it was like most people's initial reaction, "Hey, I'm just going to go out and buy masks," and that's what they did. And people started wearing masks. So I saw more people. Take for example, in by mid-January, I think it was on like the 18th or the 19th of January. It was like a Saturday or Sunday. I decided to go to the military museum because they had just renovated the new military museum in Beijing. And I mean, I love that stuff, especially World War II history. So I just wanted to go over and take a look. And I did. And I would say about 99, actually, no, it was 99% of the people I would say that I came in contact with on the street were wearing masks. 100% of the people inside the military museum were wearing masks because that was required. That was part of one of the requirements for them going into that public space. So, at that time, we were pretty much already wearing masks. Now, keep in mind, this was quite early on in the epidemic here in China. At that time, the number of cases had expanded quite rapidly in Wuhan. In Wuhan, they were facing this entire, healthcare systematic crisis because they had just way too many patients. Okay.
So
To
is
deal
that
with.
kind of your
Mhm.
aha moment? And then I'm going to cut off this video,
Mhm.
so 10-minute limit on LinkedIn, and we're going to start the second
Mhm.
phase of this
Okay.
watching. But was that kind of your aha moment where you're like, you're just seeing everybody around you wearing masks? You're like, okay, this is real. Is that, or is that not quite the case?
Yeah, I think even before that, I was just like, okay, maybe this is getting kind of serious. That was like the thoughts in my mind, but it still seemed kind of a little bit disconnected. And to me, as far as, because it was still far away, but it wasn't until I saw that Beijing started getting cases. In particular, there was a case in the community that is adjacent to my community. And then
Yeah.
that's when I said, okay, now this is really starting to hit
Hit
close to
home.
home.
No, it's hitting home. So
Yeah,
let's stop there and pick
exactly.
up here in this part two. So this is really
Okay.
interesting. I think all the Americans here, I think it's going to be very interested in this. So let me stop, and then we're going to pick up on part two right there. So this is Barry Wolfe with Dion Huey. This is part two of our really interesting conversation. And we're talking about Dion, as you may remember from part one. He's an American, born and raised, living in China, American businessman, but living in Beijing for 11 years. Dion, you were just talking about kind of leading up to coronavirus and, in China, and it just gotten to Beijing, and kind of your aha moment when you started to realize this is hitting really close to home. Kind of tell us a little bit about then kind of what were the next steps in Beijing, and what's, the stay at home, quarantining, et cetera.
Yeah, so it was actually quite interesting, because, and there's one other thing I wanted to mention. Around this time, it was like around mid-January, I saw reports in Chinese news, and mainly from the which would be like their Human Health and Services type
Right.
commission or whatnot, similar to our CDC back home. And they had reported that there was confirmation of asymptomatic transmission. At the time I was thinking, again, typical American guy me, I was like, oh, okay, maybe it's true, maybe it's not true. It is the Chinese government reporting this. But it wasn't until a few days later when the CDC actually came out and publicly said, okay, there is asymptomatic transmission. And then that's when it kind of hit, and I was like, okay, what should I do? And I was thinking about going home, but at the same time, with asymptomatic transmission, I was like, I don't want to be that patient zero that brings us back home. So I just decided to just hunker down and stay in Beijing. So it was maybe a few days later that towards the end of January, I remember the lockdowns in Wuhan. So they locked down Wuhan completely. And I have I have many friends in Wuhan. And so I was constantly in contact with them on WeChat to see what was going on. But they locked things down there. And then there were like 9 other cities in that immediate area in Hubei province that they had locked down as well. And then shortly after, that's when kind of the more stringent containment measures started taking place, I would say nationwide, where
Nationwide being all of China, or what does nationwide mean?
Yeah, so I would say all of China, because I know that it wasn't just limited to like Beijing and Shanghai, because there were many cases in Beijing. I've got a personal friend of mine, he's a doctor from Beijing Chaoyang Hospital. He actually personally treated 10 COVID patients there. And I've got other people that I know as well that are in the medical profession here in Beijing that work with these patients. So, I mean, Beijing got hit. There were about a little under 600 cases to date so far. But anyways, they started implementing temperature checks everywhere we went. In the beginning, when we first started off, it was still kind of, it wasn't as strict as it ultimately became. But in the beginning, it was just mostly temperature checks. So wherever you went, they had these temperature checks. Entering your residential community, there were temperature checks by the security guards, which actually one thing I should probably point out to my fellow Americans back home. The way that the residential communities in China are set up are very different than they are back home. So a lot of these communities, I like to think of them as sitting on compounds. So it's like a compound that is basically walled off. So if you can just picture, like, take, for example, the community I live in, we have around 3,000 residents, and which is actually small, I would say, by Chinese standards. You could picture maybe it's about like half of a city block per se. And if you could picture that city block, but we have a big wall that is around our community. So if you can imagine, all these communities are that way. Now, our community in particular, there are 4 gates. There are 2 main gates, east and west side, and then there are a north and south gate. And so what they did was they closed off all the other gates with the exception of the east gate. And this is what they did with all the communities. And so the only way to access the community now is through the east gate. And at the east gate, what they did was they set up a tent, and they placed more security guards. There were police officers there, and there were also homeowners association, like the leaders of that homeowners association placed there. And the reason why is because what they did was they started registering every single person that lives in the community. And so what they did was they gave everyone these temporary cards. So not only do we have our regular access cards, but we also had these temporary, basically COVID-19 type period cards that allows us access to the community. And security guards, they were in charge of basically checking our credentials every time we come in addition to checking our temperature. All right. Only residents were permitted into this area. If you're not a resident, you're not permitted in. So what happened was we had lots of like deliveries. I mean, there's still lots of deliveries and people ordering out and packages and things coming. Typically, they would bring them and deliver them into the community, but they were not permitted to come into the community until I think it was like 2 days ago. So things are starting to kind of slowly get back to normal. But in addition to that, there were other things that I noticed as well, even going to like the malls. So like at the malls, that entire environment changed as well. A lot of the stores, they required you to not only have a mask to gain entry, but you had to submit to a temperature check. All right. Now, what they did later on was they developed this sort of an app. And it's not the malls that did that. I believe it was like the government or maybe a third party that did that, but they have this health app. And this app now, whenever you go to malls in certain public spaces, you have to use your phone and you scan the app, enter your information, or you could like hold the phone up to your face and it'll scan your face and it'll basically pull up your recent travel history and kind of your medical history as well to make sure that in the past, at least in the past 14 days, you haven't been outside of Beijing and that you haven't been to the hospital for anything that would be remotely related to COVID-19. If you get it,
sorry, you can continue. Sorry about that.
No, I was going to say, so the thing is, like, as long as it shows up on your phone green, then you're okay. They basically let you in. If it's red, then you're denied entry into that space.
So did the malls, did they ever close? You mentioned as far as,
yeah.
Okay. So
yeah, so
leading up to and then now using.
Yeah, so sorry, Barry. So what happened, to answer that question, there was one thing I probably should have mentioned was, and I think this was another misconception for people back home in the States is, and they look at the numbers in China and they say, okay, why is it that so few people, got infected, right? Well, another thing I meant to mention was in January, in China has this Lunar New Year every single year, okay? And it's based off of the lunar calendar, and it usually falls either in January or in February. And usually you get a 7-day vacation for that. And during that vacation, you're at home with your family. So you're already at home, right? Okay. So that's usually typically kind of what it is. However, I will say that travel generally occurs at least 7 to 14 days before the start of that Lunar New Year. And the reason why is because there are so many people moving about the country that they have to leave early if they want to get a ticket to go back home. So and if you figure, even places like Beijing has a massive migrant population. I actually love being in Beijing around that time because it's so quiet and there are very few people here. So it's a perfect time to be in Beijing, in my opinion. But anyways, so that it was around the third week, I believe it was, of January, either the third or fourth week of January, the Lunar New Year. And so, this entire COVID-19 event, this outbreak kind of fell early on to the outbreak, right? Like as far as the New Year is concerned. And because of that, that coincidence, I would say that also played into, kind of limiting the spread per se, if you figure. Also, maybe some people might even say it contributed as well. If you figure there are I think an estimated 5 million people that left Wuhan, because of the Lunar New Year. However, I think that it really helped kind of minimize the spread a little bit. But so after that, I mean, during that time, in with regards to the Chinese New Year, you have to figure a lot of businesses were closed anyways. So you have a lot of businesses that were closed, lots of retail spaces. Now, malls in general would typically be open just because it is a prime shopping period. However, during this time, they were closed as well. So anything that was non-essential, basically utilities, was pretty much like the only thing that was open in grocery stores. Other than that, everything else was closed and shut down.
Let me shut off because again, we're right at 10 minutes. So we're going to pick up one last part 3. I've really, really enjoyed this conversation with Dion Huey, again, an American born, raised businessman living in Beijing. Dion, you're incredibly insightful. I love everything you're sharing. I say a lot of our viewers are involved in the retail sector, restaurants, otherwise. What is retail like now in China? You guys are probably the closest thing to a crystal ball for us Americans, what we can maybe expect 30, 60, 90 days from now. In your opinion, based on what you're seeing in China, what does our future hold?
Yeah. So, I mean, right now we're starting to see a lot more retail and kind of these businesses are going back to normal per se. And it's mainly, I would say, kind of more so the offline space is what we see is kind of going back to normal. One of the things I noticed was maybe about like a month ago, even a month and a half ago, I would say in Beijing, the malls, they were still open, right? But there weren't that many people visiting them. Okay. Now, granted, as far as retail outlets, those retail outlets in the malls were still open, but for limited business hours. So that's one of the key things, limited business hours. So they were typically closing, I think it was like around 7 or 8 o'clock in the evening, rather than waiting until like 10 or 10:30ish.
What about restaurants?
Yeah. So restaurants were still open, but for takeout only.
Okay.
So yeah, so during that time it was for takeout only. Now here we are, about 6 weeks later. Now here in China, we are basically seeing restaurants are opening up to people. People are able to actually sit in and eat. Now, as far as are they fully open like before, crowded and everything? No, absolutely not. People are still kind of adhering to social distancing rules as well as the restaurants. So what restaurants have done is they've limited their seating capacity and rearranged their seating space. So they have more space between tables, and they also place limitations as to the number of people in any given party. So they only allow 3 people to a party in most restaurants that I've seen. And
So
the reason why
the big family,
yeah.
a family of 4 even, you can't dine literally at the same table.
Yeah, well, and I was going to just address that actually. The reason why it's 3 is because you typically figure up until a couple years ago, China, lacks the one-child policy.
Right.
You typically have a mother, a father, and a child. So that's why 3. But now, I mean, you do have more families of 4, right? But yeah, so and again, it is. Even though that's the rule, I would still say it's still somewhat up to the restaurant's discretion. Granted, I would have to say that just due to the overall China's ability to really track this virus, just due to their surveillance mechanism that they have here, there are positives and negatives to that. But due to that, I think that a lot of these restaurants would still do the best that they can to limit community spread, because they would not want to be the ones on the hook, and getting fined for that. Yeah. So we see a lot of those.
Mm-hmm. Sorry. And you're mentioning as far as the tracking, and you were talking before about your phone. Mm-hmm. I mean, we don't have that here yet. Mm-hmm. I don't know when or if we will. Does that I'm not looking at political at all, but does that concern you as far as us opening up the country? Is that going to be a stumbling block, or what do you think?
For like increased government like tracking and things like that?
Well, the fact that we don't have all of that, so we don't have the data,
Okay.
We don't have as much testing as I'm guessing maybe you have, it sounds like. Does that concern you when we open up? I mean, I know you have a lot of family and friends back here. Is that a concern at all, or you feel like we're doing this the right way?
Honestly, it is a big concern of mine, I think, because the primary reason is just because this virus has been proven to be contagious asymptomatically, right? I mean, asymptomatic transmission was proven. And like I told you, I already have 6 relatives that have the virus back home in the States, and it's very, very frightening to think of, who is it that they could have possibly come in contact with. Granted, there are a couple that are medical workers, which is how they contracted it. But some of the others, it's like, okay, how did you contract it, right? So just, and oh, by the way, and there was another study that was done, I believe it was in Iceland, where out of, I think, a sample size of about 17 or 18,000 people that tested positive for COVID, I think the numbers was like 50% or like half of the people that tested were asymptomatic. So I mean, if you figure you have so many asymptomatic people running around, it's not the asymptomatic people that are contracting the virus that frightens me. It's them transmitting it to other people that have immunocompromised immune systems, or any other pre-existing type health conditions. That's the thing. I think about my grandmother and my mother and all their health challenges. And that's what it is that frightens me. So I honestly do think that right now, given that we still don't seem to have the testing capacity that is needed to really, and I don't want to say fully, I don't believe you can fully isolate, but at least identify more of those high risk areas. I think that, with that in mind, as long as we don't have the widespread testing, we should really, really rethink, before we decide to just open up the economy. Otherwise, I mean, we could potentially, increase the number of American deaths that we have, and I'm sure everyone would agree that we don't want more people dying when it could have been, averted. I understand there's still the whole, we need to open up the economy argument. I don't disagree with that. Granted, the longer that we've already lost 22 million jobs in the past month, right? So yeah, exactly. I'm waiting for the jobs reports today to see, maybe we're probably going to get like another 3 to 5 million, who knows, jobless claims. But the thing is, it's like, yes, we need to find a balance between these two is really what it is that we need. And I think that what I would say to my fellow Americans back home is, let's not jump the gun here. I know everybody wants to get back out and work and make money and keep the economy running. I mean, I do too. I that's what I want. I'm supposed to be back home, here right now and doing things, but still waiting things out. But the thing is, we need to be realistic at the same point. I think that's very important. And we also need to be more considerate of other people that could, potentially succumb to this disease, because their life too, so I hope that answered your question. Is there any follow-up that you wanted for that? Or
yeah, no, it's interesting. I mean, I honestly I was hoping for a little more positive. Yeah, and I appreciate your thoughts, and I'm not diminishing them by any stretch of the imagination. I mean, it's interesting to hear how much more testing. I guess we didn't really talk as far as testing, but as far as the temperature checks and the technology you mentioned, as far as the phones, and I think Google and Apple are working on some of those things, and it raises some concerns. I guess we've got some states that are opening up now, literally, here in the next day or two. We've kind of started that wheel in motion. I guess we're going to see what happens, and we're just going to have to. You raise some serious, some real concerns. I don't have the answers. I don't know if we do. I mean, again, based the picture you paint over there in China, I think is one that was kind of handled this process better. And again, I'm not getting political. I'm not dinging either party politically, but it sounds like we almost don't know what we're going to have here in the next, 30, 60, 90 days. Where you just have to hope and pray for the best. And I hate to say happens.
Yeah, I think, because I was looking at some of the news and some of the reports and everything, and I one that stood out in particular was in Georgia, and how the governor there was talking about opening up movie theaters and hair salons and all. I mean, honestly, these are really non-essential businesses, in my opinion. I don't think it's necessary to open up a movie theater, nor do I believe that we should be congregating in a movie theater, even if you do keep a distance, but you're still in an enclosed space that has some sort of an HVAC system that's circulating, particulate matter in the air. I don't necessarily agree with that. I think that if we are in a position to where we really have to open the economy, then I think that we should really only focus on those essential type businesses only. I mean, the entertainment, we could, we could wait that out a little bit longer, in my opinion. So we have Netflix, right?
I appreciate your time, Dion. I don't want to keep you so much for your insights, thoughts and prayers to your family back here at home. You stay safe over there in Beijing, and again, I appreciate all your time, and thanks so much for it. Let's certainly stay in touch, Dion.
Yeah, thanks for having me.